Good morning, ladies and gentlemen. I am Sridharan, son of Ilankavan, and you're watching BBC News. Today, we are going to talk about the current issue which is going around the whole world, COVID-19. As all of us know, COVID-19 is defined as illness caused by a novel coronavirus, now called Severe Acute Respiratory Syndromes Coronavirus 2, and it's a virus which spreads real fast. The new coronavirus was first detected in Wuhan, China, December 2019. Tens of thousands of people were infected in China, with the virus spreading easily from person to many parts of the country. The novel coronavirus infection were at first associated with travel from Wuhan, but the virus has now established itself in 177 countries and territories around the whole world in a rapidly expanding pandemic. For better explanation, we will be having our special guests as well, which are the doctors, part of the frontliners and from different areas to discuss about this topic. Please welcome Dr. Suman from KL Hospital.
Hi everyone, it is pleasure to be with you all today.
And Dr. Priya, who is the specialist from Johor Bahru.
Hi.
We as individuals will definitely have many questions as how would COVID-19 spreads and more. And now, today we are going to sort the answers with the selected questions by these doctors. Let's begin with Dr. Suman. Can you tell us what is the current situation of COVID-19 in Malaysia? And what do you know about COVID-19 spreads and why it's spreading so quickly?
First of all, SARS-CoV-2 is a respiratory virus. The primary way it's transmitted is human to human. It spreads very easily from person to person, and that's why it's spreading so quickly. When an infected person talks, coughs, sneezes, or simply breathes out, they release respiratory droplets into the environment. These droplets are laced with viral particles that can move on to infect others. There has been some evidence of airborne and surface transfer of SARS-CoV-2. In some cases, viral RNA has been found in the air on surface hours to days after contact with infected individuals. However, that RNA is not always infectious. Airborne transmission of the virus can occur in healthcare settings where specific medical procedures called aerosol generating procedures generate very small droplets called aerosols. Some outbreak report related to indoor crowded space have suggested the possibility of aerosol transmission combined with droplets transmission, for example during choice practice in restaurants or in fitness classes.
That was a very clear explanation about how it spreads, and now I wonder how all these cases of COVID-19 was increasing day by day, Dr. Suman. I hope we could get rid of this as soon as possible. Dr. Priya, from your opinion, all of these days, what are the incubation period and symptoms of COVID-19?
The incubation period, amount of time between exposure to the virus and development of symptoms of COVID-19, ranges from 1 to 14 days. It is mostly 5 to 6 days, and some rare cases has been reported to be longer than 14 days. Symptoms of COVID-19 are varied. They include fever, chills, cough, shortness of breath or difficulty breathing, muscle, headache, loss of taste or smell, sore throat, runny nose and vomiting. Most people don't experience all these, and many people have absolutely no symptoms. Fever, dry cough and tightness are the most common symptoms if symptoms occur. Serious symptoms include difficulty breathing or shortness of breath, chest pain or pressure or loss of speech or movement. Anyone experiencing double breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, or bluish blip or face should seek medical attention immediately.
Coming back to you, Dr. Suman, what is the risk of infection in pregnant women and newborn babies? Does it affect the upcoming generation as well through this virus?
Existing data indicates that pregnant women who have contracted SARS-CoV-2 experience similar illness and symptoms to non-pregnant women. Pregnant women who have diabetes or an obese may experience more severe disease. A limited number of cases has been reported with good overall outcomes and no severe illness for the newborn. All pregnant women should follow the same general precautions for the prevention of COVID-19, including regular hand washing, avoiding individuals who are sick, and self-isolating in the event of symptoms. A healthcare provider should be consulted by telephone for an advice.
That's actually quite serious, doctor, since there is not any additional precautions for the pregnant ladies, and it might be turned bad if it's not considered throughoutly. Thank you, Dr. Suman. Dr. Priya, when and where the people should be tested for COVID-19?
Anyone who develops symptoms of COVID-19 should be tested for the virus wherever possible. Testing is also recommended for the people who do not have symptoms but who have been in close contact with the case of COVID-19 if possible. These tests are called PCR, that is polymerase chain reaction tests that are able to detect the virus. They are usually conducted on sample collected from the throat or nose using a swab. Testing strategy will be adapted to the local situation, and public health authorities may decide to test only subgroup of suspected cases based on the level of community transmission of COVID-19 and available resources.
From your simplification, Dr. Priya, seems like all the individuals should go for a swab test to protect themselves from the virus because they will quarantine themselves if it's positive and it won't be able to spread among the others. Dr. Suman, what are the treatments that could be helpful to prevent this virus?
Up to now, there is no specific medicine shown to be effective in the prevention and treatment of COVID-19. The General Protective Action for Respiratory Infection suggested that people should be responsible in protecting themselves from virus exposure, including washing hands frequently, avoiding touching face, and avoiding close contact with infected people. It also suggested that patients in early onset of disease and with mild symptoms should self-isolate themselves to protect other people and to prevent the spread of the disease. However, patients with more severe symptoms may require hospitalization to be closely monitored and supported.
Alright, Dr. Suman, it was well clarified about the treatment. And Dr. Priya, could you please tell us how to protect ourselves from COVID-19?
We have to avoid touching our face. The virus can enter your body, your eyes, nose, or mouth. So it is important to avoid touching your face with unwashed hand. Frequent washing hand with soap and water for at least 20 seconds or cleaning hand thoroughly with alcohol-based solution, gels or tissue is recommended in all settings. The people have to avoid close contact with people infected with COVID-19. We must avoid social gatherings such as physical meeting, events, and other social gathering in area with ongoing community transmission and follow local recommendation applicable to mass gatherings. We should wear a face mask indoor and outdoor whenever physical distancing with other people cannot be guaranteed.
That looks quite serious, and it seems like the residents of Malaysia has to be extra careful in the coming days. They have to take extra precautions as well in order to escape from the virus since it's spreading too fast, especially to the youngest and eldest one. To summarize, COVID-19 is a new disease that has caused great impact to the people's daily life extraordinarily. We as a community of shared future for mankind need to take collectively and quickly strong emergency responses as a battle against our common enemy, the new coronavirus, not only in China but also in the world. All partners of international community and country leaders are encouraged to proactively take strategic action as soon as possible to fight the COVID-19 together. Hard time will end finally, and we will meet each other in blooming spring soon. Thank you.